600 CDC emails released under a Freedom of Information Act, FOIA, suggest that the CDC may have downplayed concerns about COVID vaccine efficacy rather than fully informing the public. We will examine two emails that focus on messaging rather than transparency. Senator Ron Johnson participated in a hearing with RFK Jr. on September 4, 2025. The discussion focused on vaccine policies and transparency. He provided data showing more than 9,000 deaths following COVID-19 vaccination on the same day or the next, which needs proper investigation.
In the federal health agencies, interagency communication hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out. The facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination or within 1 or 2 days.
An internal CDC email reveals that the messaging was specifically designed to prevent the public from knowing precise information on risk and protection. This suggests a policy preference to avoid public knowledge of risk levels. Florida Surgeon General Joseph Ladapo raised concerns about the mRNA COVID-19 vaccine's DNA content, citing it as a serious public health risk, underscoring Senator Johnson's vaccine death data. It appears that the CDC did not address this. Under Joseph Ladapo's leadership, Florida was the first state to advise against COVID vaccinations for healthy children in 2022. This decision reflects ongoing debates about vaccine recommendations and public health policy. On September 1st, President Trump called for pharmaceutical companies to release the success rates of their COVID-19 drugs, which are still not publicly disclosed for independent review. Why has this data still been withheld if we are to believe the prior administration's CDC claims that the drug is safe and effective? Key takeaways from the CDC email leak include the use of PR tactics to manage public perception of vaccine safety. Over 600 pages of documents were released, highlighting a shift from full transparency to narrative control.